Hello, everyone, and welcome to Birth Workers Without Borders. Welcome to episode 4. We are going to be discussing today mental health awareness, how to stay balanced during pandemic. What is mental health awareness? How do you promote mental health awareness in a culture where this type of holistic healing isn't prioritized? And also, what is advice for someone who is going through severe mental health issues where they can't get off medications and don't feel that holistic healing is even an option?
And we're going to dive into how does our guest help to bring all her knowledge and experience together to help families with anxiety, depression. How can aromatherapy help families with mental health? And lastly, what is infant massage? So stick around because we're going to dive into this. So, guys, welcome. You guys are tuning in to Birth Workers Without Borders with your two hosts. My name is Stephanie. My pronouns are she and her, and I am a mother of 6 children from 17 to 3 years old. And I am a full spectrum doula, a women's health coach, and a student midwife. And we are strong believers here in the collective that families are 100% free when they have full control of their health and bodies.
Sorry, I was muted. Hi, I'm Serena Rose Doucette, and I am a mother of 2 stepchildren and a 9-month baby. I'm a licensed massage therapist, a full spectrum doula, and also doing now cupping and Islamic traditional healing. And so we created this podcast because we are passionate about educating our community throughout fertility, birth, postpartum, and into parenthood. And so we're thrilled and honored to introduce our guest speaker, licensed professional counselor, Reiki master, certified educator of infant massage, certified yoga instructor, and director at Namaste Tribe. You're muted, Steph.
And I had the honor to meet our guest with our women's circle that she used to provide, and that was really healing for me, and I loved it. And she's always bringing so much gifts around the community so we could heal, we could be connected with ourselves, mind, spirit, and body. And some of the things that she's doing right now is she's doing free delivery from her boutique in Namaste Tribe, and you'll have a lot of different goodies from bath salt, oils, crystals, candles, plants. And by saying that, she's going to start a monthly subscription box that is coming soon, so stick around. And lastly, she's also offering 5 weeks of infant massage series where she is going to start on March 29 this year. And for more information for you to give, stay updated about all her events and ask her questions, you could look at her website, www.namastetribe.org, or you could email her at brenda@namastetribe.org. So let's welcome Brenda. Brenda Schultz. Sorry, Brenda Schultz, and I'm really happy to have her here. So let's welcome her.
Thank you, everybody. Hi, I'm Brenda Amador Schultz. It's an honor to be here with you all today. Thank you for having me.
Yeah. So let's talk. How did you started becoming a counselor and all of these things that you have to offer to the community?
Well, I grew up with a lot of holistic care from my father, from generations of healers in my family. And so I grew up knowing that there are alternative ways, combined with traditional medicine to provide balance within, the mind, the body, the spirit kind of thing. So growing up with it has definitely been a great influence with, being taught that from a really young age. I've been interested in the field of psychology since I was little, and so I always knew that this would be a field that I would be, going towards. And yeah, it's been really great working in the field. I really enjoy helping people, seek balance through their minds. As I have professionally grown, I've realized that, balancing the five senses, mind, body, spirit, emotions, and social, is what I believe helps individuals thrive. And so that's the reason why I've also explored other mediums, to help individuals find balance.
And a lot of the work of naturopathic healers and practitioners and people who practice this way of life, it's kind of like you're a minority in like places where, the masses are seeing all the advertisements everywhere for fast food and, just like the opposite culture we live in. So how do you navigate, that struggle of trying to spread all of this more natural healing and how to heal ourselves in these ways, in the lost ways, and in this culture where we don't prioritize this?
Mhm. I promote myself authentically, and so I only use methods that I have tried myself and that I have researched and seen that work. And this allows me to be confident in my practice, so that way I attract clients that are within that same vibration. And I always feel that, the people that believe in your work are the ones that come, even if you only have one, right? And so that's one person you can change towards being their best and highest self, right? Because they're coming to seek change. And so I find that by being myself and staying true for what I believe and not teaching things that I don't know, it helps me with my practice. And that's what I have found works for me.
Yes, and yeah, because you provide so many things like Reiki, energy, and do you feel that going with energy healing and Reiki makes you feel different from other counselors out there? Or in your studies as becoming a licensed counselor, did was that even introduced to that picture when getting your license?
So no, we didn't research Reiki, in grad school. It's definitely something that maybe is briefly talked about. Holistic healing is talked about. But I did find that when I had, clients that I saw with just my traditional LPC license and, then adding Reiki, I felt like I almost amplified, their ability to find more balance in more ways than one, right? And so I have clients that I have worked with throughout the entire history of my career, and I've noticed that, having all these extra abilities to be able to help them with has provided them extra care. And so that's been really great, being able to see people that maybe work with me and then leave and then come back and then leave and come back. I find that as I continue to expand my knowledge, and I feel like I'll be always be a student, right, to continue my growth, because there's so much out there that we don't know about and that we will continue to learn, I think can only help myself and others as well.
Mhm.
Hmm.
Because I was also like learning and listening to different books, right? And how yoga and emotional traumas, especially for people who have been diagnosed with PTSD, that they started using yoga, and they did like a 10-week series. And sometimes, we might forget the details of trauma because our body protects us that way, or there's times where, individuals find it hard to explain and find the words. And by doing yoga, it reduced so much symptoms of PTSD. And have you ever experienced something with Reiki and yoga improving more? And I know you said it amplifies, but have you seen it in your practice?
Oh, absolutely. Energy, tension collects in our body in different ways wherever we've received trauma. And so, by allowing, the asana flow to come in, or even the other limbs of yoga, it allows a person to receive the balance that they need, whether it's mindfully, physically, spiritually, or all of it. And so, I have seen that when individuals incorporate more into their practice, into their healing, into their journey, they do receive more benefits. And so I have definitely seen clients, that do, it's almost like if you're in training, right? Like, this is how I always like to say, if you're in training and let's say you want a six pack, you don't have it, and you just work out, but you don't have the diet, you don't have the sleep, you don't have the water, right, to drink and supplement your body and detox how you need to and lower stress, right? You're not going to really achieve those goals as quickly or as efficiently. So it's the same thing here. The more techniques you apply to your practice, you're also activating all of your senses, and that in turn allows yourself to really find and that alignment that you're looking for.
And what exactly is mental health awareness?
So mental health awareness, which I'm really glad that it's becoming bigger and bigger, is really being mindful of all the information that has to link with mental health, whether that's diagnoses, illnesses, imbalances, treatment options, maybe even professionals that you can seek out to contact, who to go to, because it's a really big team of mental health professionals. You have from the psychiatrist to the psychologist to the therapist to the caseworkers, social workers, and so it's a big team. And having that awareness also allows people to identify maybe behaviors that are unhealthy, and allowing them to seek treatment. And it's not a reason to say, to stigmatize it. A lot of people think it's very taboo to talk about mental health. I think that, if we lived in a more peaceful world, we wouldn't turn on the news and see what we see. And so having that mental health awareness is very important so that people can recognize that, people do things that are the way they are because it's probably an imbalance of some sort.
And
Right. Oh,
I was just
but
gonna say that on like social media and different things, I see a lot of now like young people and younger generations very aware of mental health more, and like just trying to like at least like talk about it socially or whatever with community. And I'm wondering, like, is it like, as the definitions are changing over time now, I feel like maybe mental health awareness like being very heavy, and then now everybody's checking in with their mental health, it seems like. And like when it comes to like I see like all these like self-care like baths and different things like this, where we're just like, what can we do that's simple that we could do at our house, that's for us, that's not in our culture, that is helping with our mental health? So I'm just like wondering, like, have you seen like also a shift in like these definitions?
I I'm not active on social media, so I'm not really aware of what's out there. I don't watch the news. So I can't really tell you what's out there. It's great to hear that people are being very open about mental health and self-care, because I really promote that all the time. I'm sorry I don't have more about the social media aspect, but I've taken a really well-deserved trip from it, and it's been a really nice self-care for me, to not be on there. So I can say that it is really important to also be mindful of, you know, each other and treat each other, respectfully and kindly, regardless of what your diagnosis is, if there is one, and also to be mindful of not just calling out a diagnosis if you're not trained, because I hear that a lot too, like, oh, she's this, she's that, and it's not appropriate. I mean, even clinicians don't do that, so I'm very mindful of also teaching people as clients if I hear them say, oh, they have, they're bipolar or they're this. It's like, do they have a diagnosis? So it's also being mindful of not um, either diagnosing others without having the proper training and not diagnosing yourself, right? Because if you go on online and look up symptoms, people have a lot of things that they don't have. So hopefully that
Yeah,
answered your question.
I
Okay.
do find that I have friends or family that are like, oh yeah, I have bipolar, and I was like, do you do? And she's like, yeah, I do because I have this or that, or I do this. They respond a certain way because maybe their traumas, their situation, their environment, and I'm taking a trauma informed course where it's true where you say that maybe they just say they're this just because maybe they think this is the proper terminology to explain why they act a certain way. And there's times where maybe someone who had a rape experience, maybe that individual doesn't even consider themselves a victim or a survivor. So even labeling should not even be labeling the same thing as someone just because you look like a girl. You should not say, oh, that's a she because you don't know instead of assuming. So I think that's what, when you're saying that, it all in ties of what I've been learning, to not assume or to say or something unless, but where's that balance where someone says, I do feel like I'm this without being diagnosed? Because they truly feel like, do you navigate them to do self-discovery that they're not this type of diagnosis if they're truly not?
I do. And even if they have that diagnosis, I also encourage them not to say, I am, defined by their diagnosis, because the diagnosis is just a part of them. It's a characteristic of them. So I do encourage people to, think of more of the characteristics. Like, for example, I feel angry, I feel imbalanced, I feel irrational, I feel upset. I'm thinking, unclearly. I'm thinking, irrationally. I'm thinking, angrily or whatever, right? Instead of focusing on, I am bipolar, I am depressed, I am anxious, which is the big one, right? I'm anxious. So instead of that, it's like, I feel afraid, I feel worried. So I encourage more of the identifying, the behavior and the feeling and the thought.
If it's okay, I was just gonna say I'll use myself as an example, but like throughout my life, I've been labeled different words, for mental health or for learning disabilities or whatever. And I'm also like ongoing in this like process of like, I've always kind of rejected all of the labels because it's like, okay, like we're all such individuals, like we're all so specific. All of our life journeys have like made us to the like how can like one medication or one diagnosis like solve like all the problems, and how am I in this one, all these thoughts, and then there's that spectrum of like, I have a friend, a really really close friend, we're talking every day almost like we're counseling each other type of a thing. And I've just learned from my friend that like they feel empowered by their labels, because I've also been like, but you're not those things. And it's like, yes, I am those things, because that helps just to explain like why I do things, and it helps me have sanity, like for now at least, and I'm just like, okay, like, so I don't know, I'm just like, there's like, I guess also a spectrum of that too, huh?
I think so because, everyone is different. Everyone processes differently. Everyone has their own perceptions. I always hear nature versus nurture. I believe it's nature and nurture. It's both of them, right? It's not a fight of whether it's your genetic and your environment. I think it's all of it. All of it contributes to you and your processing. And so I think if it works for someone, and it doesn't work for someone else, the more important thing is personalize what's healthy for you. If what is healthy for you is saying, hey, I have bipolar disorder, or, I have anxiety, and this helps me identify my behaviors, and it's healthy for them and it services them, I think that's great. But I think that if there's an individual that says, hey, me identifying with the disorder that I've been diagnosed with, doesn't help me, then I think that that's also important. So I don't think there's a one size fits all. I think it's contingent on the individual. And one of the things I always suggest to clients, because they always ask, is this good or bad? I like to say, is this healthy or unhealthy? Right? So if your tool, your inside measurement is, this is healthy for me, then it sounds like it's good for you, right? If it sounds like it's unhealthy for you and it's causing distress in your life, then I suggest maybe, find something else that works for you.
Right. Because, I mean, mental health awareness is really good to bring into light, enlightenment for people to understand where they stand. Maybe I need support because it sounds like this description could be probably where I'm going through, right? Those are really nice things to bring in the light. However, since I came from a history of like domestic violence and we have this mentality how like professionals are bad, they're not really there to help you. And the same times they are, but then there's times that they aren't. So it's just like you're just a number. And versus helping you, they're saying, oh, this is what you're doing bad because it's in our AK rules, and now we're gonna just throw all these regulations that you have to apply to not be in our case, but then it creates more chaos. It's not even actually helping. And this is where I had really hard trouble to find counselors or support because you have that fear that they're going to think you're crazy, and they're not actually getting the help. And then they just make it worse. And then you just go talk and talk, and then you might cry, but then there's like no solution. And I have felt that I just leave there with like drained. So, do you have like any insight of that, what I'm just expressing?
Absolutely. Well, number one, therapy is exhausting. So if you come out of there drained, it means you're doing the work. So congratulations on doing the work, because a lot of people don't. So if you're coming out there, feeling happy, feeling sad, feeling whatever, I think that's important to note because something's happening, right? Something's moving within you. And so, like clinicians, in all aspects of jobs, there's always clinicians that are really dedicated to their work and some of them maybe not so dedicated, right? And so I'm not sure who you have had, but if you feel that you maybe haven't gotten someone that you felt you were receiving the help that you needed, I always think that, I never take it personal if somebody says, hey, I'm not growing from you anymore. I refer them out. I discharge them because there is not a non-attachment, right? My job, and I've vowed ethically to help individuals. And if I can't help them anymore, then I refer them out, right? Because my job is to help them. And I encourage honesty in my practice. I always let clients know if something's working, tell me. If something's not working, tell me so I understand. I do think that depending on where you go seek treatment will be the type of style that you receive. If you're going somewhere like a government agency, they're trained to follow checklists, right? Check, check. You meet this box or that box. Because that's just how it is. And it's, billed through insurance. And that's how it is, right? Insurance is this way or you don't get covered. So, depending on where you go is the kind of treatment you'll receive. If you go more for a private practice, someone that maybe, doesn't work with insurance, that's more my style, right? I do everything out of pocket. So I also have the liberty of doing the techniques that I feel work for individuals, not just CBT, right? And so I think it depends on, who you're going to seek treatment with. If you find that you don't like the counselor, change it, and I hope that, individuals don't get discouraged by saying, oh, here I go, I have to start all over again. And yeah, it sucks having to start all over again, but know that you can always pull your chart and take it wherever you go. You have that right. And if you feel like you're not growing with your therapist, see if maybe you can talk to them. I always encourage talking to them, and maybe saying, hey, this is not working for me. Can we maybe find something else that I can learn with, or, being honest. And if it doesn't work still, then find someone that you connect with in their type of methods.
We were just having to talk about this as a family last night for our kids. Like, it's not really the question, like, is counseling work for you, say? Like, no, it's like, does your counselor work for you? Like, I was saying, like, not dating, because kids shouldn't be dating, but like, kind of like we should be shopping around. I don't know the right word, but like, we should be introduced to many people, to like see who we connect with. And that would help, like you're saying, eliminate so many problems.
Yeah, and I also hope, sorry, just one quick thing.
Yeah.
I also hope people don't get discouraged from counseling if they do get a counselor that they don't connect with, because I hear that a lot too. Well, I tried it, and also remember, your first session is just intake. So that is not going to mean, oh, I'm already 100% better with session number 1. So there's also that expectation from counselors that we do the work for you. And that's not what counseling is. Counseling is we show you how to do the work, and it's up to you to be accountable to do the work. So sometimes I hear that, like, well, I went to one session and nothing happened. It's really hard to have something happening and for you to have a breakthrough by just session number 1. That's intake. We're getting to know you. This is why we do counseling with people that we do not know, so that we are objective and we can provide that unbiased feedback, right? And so here we're getting history, we're getting who you are, why you're here, what made you come, right? And so I hope individuals, don't stop getting treatment because of session number 1.
Mm-hmm. And kind of going back to this, like, where how you were saying that you don't really, you attract the right people, and it's about connection and things like that. It's really beautiful. That's how it should be, like, everywhere for everything that we do. But yes, insurance and all these bureaucratic things that we live in. So I just discovered with my friend who has lots and lots of medications and goes to counseling and needs therapy often and has lots of different ways to help with chronic pain and all these different things. And I just now, after like so many years of being friends with them, I'm starting to make glycerin tinctures, like herbal glycerin medicine. And they're like, now I can like access medicine. But I mean, they're on the internet, glycerin medicine, that, like, different ways. Cause I just, just learning, you can't mix, like, a lot of times, like if someone's on 14 pills, can't mix alcohol. So if someone is trying to slowly, change things in their lives, make things more natural, do you have sort of like program or advice for people like that are in that place of like, of course I don't want to be attached to all this, but if I stop taking this medicine, like, you don't know what my life is like, so what about that?
I suggest to clients and people that want to come off of medication to continue working with their psychiatrist. That kind of medication isn't something that is recommended for you to just quit cold turkey. They can have some serious side effects. And so psychiatrists generally are really supportive of you coming down the medication. And so gradually reducing your dosages will help you not have adverse effects and have, really, really strong side effects. And so I do recommend finding a different clinician, right? A professional that has the training in the type of new medicine that you want to work with, so that you can have that team of people or one person, whoever it is, so that you can have that proper guidance. Mixing medication with any kind of alcohol or drugs is never recommended, even if you only take one pill, because you can have severe effects. I've seen, patients in the psychiatric ward have really, bad effects where they entered psychosis because they mix medication or drugs with their, alcohol or whatever they used, right? And so I think that, people that are seeking maybe outside sources with alcohol or recreational drugs, or trying to maybe find some kind of numbing or self-medicating with some of the symptoms that they're experiencing. But I do know that there are some clients or people that, are on medication for life, and they're thriving and they're fine. I do know some people that, don't do well with medication. So everyone's different too, right? I do know that there is not a pill that exists that will make your life completely 100% better and, balance everything. That doesn't exist. So medication is just to help with symptoms, reducing symptoms, helping with symptoms. It's not a behavior modification, tool. That's where therapy comes in. So it is suggested that if an individual is on medication, the best thing they can do is pair it with counseling so that they can work on, what made you feel or act or, think the way that you're feeling so that you can actually get to the root cause of things and not have it be something that you're continually dealing with.
Right, because I also follow, this holistic psychiatrist where she shows how there's times that you're taught as a psychiatrist that you right away diagnose versus finding is there other things you could do to balance your body. And I do believe in medication. I believe that it comes with its purpose. And like you said, some people thrive, some people don't. But again, there's been studies have always showing that for a long term of something, it could affect and create more side effects. And then you're gonna have to take more pills because it might disturb this organ and this, and goes like a whole cascade of stuff. And so also having someone who's gonna help you to reduce it, like for someone who is in high blood pressure medication, they want to come down, and studies have shown what links to that to cause to that extreme. And also having therapy, and if that's yoga or counseling. Is there anything that you suggest in nutrition, and maybe the body is lacking some certain nutrient as well to come back to homeostasis or maintain?
I do believe that nutrition and what you put in your body is definitely conducive to how balanced you are. I do recommend clients to keep, as clean of a diet as they possibly can, eating, superfoods, focusing on veggies, focusing on fruits, whole foods, right? That are, things that you get naturally instead of processed foods. There is such a thing as also addiction, right? With eating processed foods and things like that. And so I'm not saying go be vegan, right? What I'm saying is because even sometimes a lot of vegan food can be very processed. What I'm saying is be very as natural as possible, right? Try to buy things that don't come in a package. Try to buy things that, grows from the earth, as natural as possible. And, to talk about what you said with medication, and natural things, there are even some herbs that are very strong that can also cause internal damage within people. And so, this is why I say it's very important to work with someone who knows what they're doing so that you can have the proper guidance. Because I've also seen, some people that have been poisoned or, that enter psychosis because of plants. And, they took way too much of what they needed to take and they, got stuck in psychosis for a very long time. I see this a lot. I've seen this a lot with teenagers, that maybe are going through really difficult times. And I've seen this here in town in El Paso, where I don't want to say it because if someone's watching, I don't want to give them ideas. But there is a plant, here in town that can cause hallucinations, and if somebody takes too much, they can enter psychosis and stay there. So I've seen them happen as well. So I think always contact people that know what they're doing and do the research. A great clinician and a great healthcare provider is not afraid of questions. If you say, hey, I have some questions, I kind of want to see if we're a good fit, they're open to that. And if somebody isn't open to that, I think that's definitely something that indicates maybe looking somewhere else.
And so, do you focus only in anxiety and depression for anyone like families, mothers?
No, I don't just focus on that. I do specialize in that. I would say probably 100% of the clientele that I have are seeing me for anxiety related disorders and or depression, self-esteem. Those are the things that I specialize in. But I also see a lot of clients with PTSD. Postpartum depression is a big one, and other things. I mean, I've also done, addiction, sexual addiction, gender identity, what else? Transgender communities. I definitely also serve the LGBTQI community. I've been listed in the purple pages since it opened. And, we have training with them that we can also take. I also see, let's see what else, divorce, family violence, Abuse is probably, I would say, something that a lot of clients have gone through. But really, the other thing is trauma, right? Because trauma can be traumatic in any ways, right? You can go through something traumatic that isn't traumatic to somebody else. And it could be something that somebody else can be like, wow, I can't believe you're traumatized by that. But the whole point is not having others validate your trauma. The whole point is that for you and within your perception, something was traumatic and is keeping you from thriving in your present moment.
Do you feel that, even in the counseling and the psychology realm, that right off the bat, or for like many years, more than 20 years, they have thought trauma was just one particular, like it has to be a certain event to consider trauma, or it has always been like that where it's like, oh, it really depends how the person, and there's no right or wrong. Do you understand what I'm trying to say?
Like if it's something new, or has it always been only one thing or the other? Is that what your question is? Okay.
Yes.
So I know that the how could I say this? Psychology in general has been something that has really come a long way. It has definitely, evolutionized from where we are today to where it was back then. It's so different. I mean, they used to use experimental psychology on individuals. Maybe if you went further back, mental illness was looked at like you were possessed by demons, right? In other centuries. And so it definitely has evolved. It depends on which, you know, how could I say, there's so many therapeutic, views, and there's so many therapists out there that it also depends on the viewpoint. There are some that it's very like, no, it's like this and that's it. And there are some, other clinicians and therapists out there that are more like, no, maybe it's other things, that can also be traumatic. And so I think it depends on the style of therapeutic techniques that the clinician uses. And but I will say that we've come a long way. They used to do a lot of lobotomies and things like that, straitjackets, and that's not used anymore. And so we've definitely changed a lot of how psychology is today.
Wow. So yeah, everything always is developing, right? Even like with birth. There's so many things that has happened that I'm also learning that's just like, oh my god, I can't believe this has been going on. But it's nice to have someone like you who are holistic and sees, that does continue studying and branching out and learning, because you know that things change and that a person is very different. It's not going to be a path for everyone, or sometimes it'll be a mixture. So that is really good. That feels better. And of course, we have to continue searching until we connect with someone. Um, which is, I feel like it's like that's good because we have options. And there's times that when you're in a situation and you're like really not involved, but you're put into like this system that is more government, it's really hard to find options, especially for someone who don't have those resources or think that they don't have those resources because of their situation. So it's just, do you feel like there is an easier way to bring awareness and how to find your options? Because I feel even with birth, you just try to believe or trust the authorities and you don't know you have options.
I think it's important to, first and foremost, to listen to your intuition and your inner guidance, always, even when working with someone that you really enjoy working with. Because when you learn to listen to your intuition and what you need internally, that's your biggest gauge, because no one knows you better than you do, right? As long as that intuition, of course, is your real intuition, because sometimes people think that their intuition are things that are, not their intuition. And so, to answer your question about options, even people with, let's say, Medicaid or Medicare and government aid have options. And so I recommend getting a list of providers, from your insurance, whether it's private insurance or public insurance. From there, have your list of providers and do your research. Sometimes people don't want to take the time to really research who is out there, but most clinicians have profiles online. Some of them don't, some of them are a little older and maybe they're not very tech savvy, but maybe they have, like a Google listing or something. Or you can call their office, and some of them offer, free consults, like 15, 20-minute consults. Or you can maybe send them an email and say, hey, I'm looking around for a therapist, for either myself or my family or my child, whomever, and ask questions. I think it's important to ask questions and to be informed so that you can make a choice of what you're looking for. If you're looking for a therapist that is very direct, that is very, here's the reality of things, and you don't do well with that, then don't see somebody like that. You know, go with someone that teaches in the way that you learn. And so there are government agencies out there as well that, provide different, sliding scales for people that can't afford whether it's medication or, therapy. And, there's also nonprofits in town as well that can offer either free services or sliding scale as well.
Yes, I do know some do that. And so we're gonna kind of switch the topic, but still gonna be related. Do you find that infant massage helps moms who might have anxiety or depression with, incorporating infant massage with their babies?
Absolutely, absolutely. I do believe that it helps. I got into infant massage because I became a first time mom and I wanted to see natural ways to help my baby with gas and colic. And so I didn't really know how to help her. It's something that is believed to only exist here in the US. You don't really see it in other countries, right? And so I wanted to learn how I could help her without giving her medication at such a young age. When I took the course, I realized that there were so many great benefits to infant massage. It really helped me connect with her on a deeper level. It helped my partner connect with her on a deeper level. Sometimes parents, especially dads, they're like, well, I can't do anything. I can't breastfeed, right? And I don't know what else to do. And so it also helps boost their confidence to say, hey, you can massage them, right? And what I love so much about this program is that it really promotes nurturing touch a lot. And so I believe that by promoting nurturing touch, we really teach kids at a very young age that they need permission to be touched. And this promotes a safer world. And, I really see that the benefits of infant massage are so great. It helped me also be more confident as a parent, right? To know what to do if she felt, that, she had gas and colic, or it helped me know what to do if she was teething. It helped me know what to do if she had growing pains. And as, I have the kids, I have 3 kids. I have a stepchild and I have 2 that I birthed on my own. And so, it's really helped me connect with them on a level that is non existent if you don't promote touch, right? Because touch is important, but healthy touch. And so I have, I got certified to teach other parents this beautiful gift. And I have found that the parents that I work with, whether they're new parents, returning parents, they do feel more confident with how to hold their babies, even newborns, right? Because they're so tiny and you're like, how do I hold a newborn? And, I've even helped some parents whose babies were in NICU and they couldn't come home right away. And they learned how to, massage their babies in the hospital when they can't hold them, right? Because maybe they're tied with tubes or something, right? And so this has allowed parents to also bond when they're pregnant. And so some moms, come in as they're pregnant and they practice with a doll. So that way, when their baby is born, they know what to do.
Yes, I remember doing your first series here in El Paso in the retreat.
Hmm.
And I just felt like my daughter was more like, who are those babies? Why are they here? I don't want you to like touch me right now. And I was like, Mom, like, I want to massage you, But it was really nice. I thought that was a, especially in person, having other moms, even though virtually could be very powerful, as the more that we're doing this virtual world is very powerful as well. But that was like a really nice um, intro to it. And and so yeah, so you're gonna start your infant massage series that is 5 weeks starting March. And it's gonna be virtually, right?
Yes, correct. Yes, so recently, with the pandemic, the International Association of Infant Massage now has allowed us to teach virtually. Initially, they didn't allow us to do that, but with everything that's happening, a lot of clinicians have had to turn, to the virtual teachings, and they're still beneficial. I know it's not the same, as seeing each other in person, but I think that having a virtual training versus not having the training at all, really reaps the benefits of what massage does. So, yes, it's starting in March. It's a weekly meeting of moms and dads or whomever wants to come, right? Of parents of any race, any age, any sex, whoever wants to come comes. Sometimes even grandparents, join in, whatever caregivers want to come. Sometimes even foster parents, adoptive parents can also come to the sessions. It's really whoever is in that child's life, right? And so even siblings, sometimes siblings, come to the training so that they can learn how to massage their, new babies, maybe siblings, so that there's also less tension, right, with the arrival of a new baby that comes into the home. And so it's a really great program. I really believe in it. Like I said, I don't teach things that I haven't tried myself. I continue doing it with my children, and they love it. And I wish I had had that when I was a baby. It would have been really great.
Yes.
Yeah,
Well,
teaching them the culture of getting regular massages early. Oh my gosh, yes.
Yeah.
yeah, definitely. And where can, people find you or ask you questions?
Yeah. So namastetribe.org is the website that we have. If anyone, wants to contact me, they can contact me at brenda@namastetribe.org. That's the best way to contact me. I'm in and out of, sessions or events or things. So that's email for me is the best way. Sometimes I'm out of service, and so once the email comes in, I answer it. I'm not really reachable via social media, so if you send me something there, I'm sorry, it might take me months to respond. But email me. I try my best to respond within that same business day or the next business day.
Awesome. Yeah. So, is there any other questions or anything else you would like to share before we end this awesome talk?
Let's see, what do I want to share? I do want to share that as a clinician, I have during this pandemic been working inside of hospitals. And so I've been working in COVID units and isolation units, and I've been working with a lot of essential workers, providing them counseling, for all the stress that they're going through. Um, what I have found is that, it's important to come from a vibration of unconditional love and light. There's so much out there that's very fearful and fear based and anxiety driven. And I believe that, with everything that's happened, one of the positives that has come out is allowing people to simplify. And by simplifying and really going down to the root of, just loving yourself unconditionally and loving others unconditionally just as they are is super important. I've definitely taken a step away from social media just because it was so distracting, from the work that I needed to do. And I find that, whatever self care is what helps keep you balanced is super important. And so focus on yourself so that you can be there for the rest of everyone around you. We are a ripple effect. And so the more self care and love you put into you, the more self care and love we put into this world. And it is possible, to live in a place where we have, less violence and more love and more peace. I know some people don't believe in that. I believe one of the things that I've been thinking of so much is that I think the people that don't believe in that perhaps don't experience that. because there is a really large community of individuals that I know that are friends, that are colleagues, that, are very strong about, being positive and doing the work. That somebody is in alignment with life because they do the work. There are many people out there that are teachers, guides, spiritual people of the community, and perhaps they're not in a good place and they're not teaching positive things. And so just remember that everyone, even us, healthcare professionals, are humans first, and we all go through things and experiences, and mental health doesn't discriminate. Mental health can affect people of any age, race, color, gender, whatever socioeconomic status. It exists, and so I think being aware of recognizing symptoms and things like that is important, and provide a non-judgmental space for them to get better, and offer them love, and send yourself love first.
Yes, absolutely. I do believe that. I'm so sensitive to my body that I'm just like, wow, I behaved horrible today with my husband or something, or I just like snapped on him, or and it might not even be him. Maybe he did do something irritating, but it wasn't like I had to go to that extreme too. And I have to be like, wow, okay, why is this happening?
Oops, sorry.
Why am I experiencing this? And there's times where it could be overload of things, from duties and responsibilities and all these things that I want to do. And there's times that's really important to know how to like pause and step back, because I feel many people feel like they have to always rush. And even when I wake up late, say I have like a huge list to do, and say I woke up late because I said I need to sleep, like I really feel like today I need to sleep like maybe an hour more. And before I used to feel like in this panic mode where I was like, oh my God, I should have not slept, and now I gotta do this. And before I was just like, now I'm just like, okay, I'm just gonna do what I can, do an hour of whatever I need to do, and pause and get as much as I can. And I feel that that has helped a lot versus being in this like crisis mode that have to be everywhere and running, and it just creates chaos, and then our relationships, start diminish, within our own family because I'm angry and upset. And so I think learning how to pause and learning that it's okay if you don't do everything, just start prioritizing a little bit more and still be able to like breathe with all that is important.
Yeah, and also like I love that you are not on social media, and that small minority in the world now because like a long time ago when I was going through a lot of mental health stuff, like 6-7 years ago, that was one of the one thing that this healer prescribed to me, that was like, you are too sensitive. You do not need to know everything in the world. Like, you don't need to feel everything. Just stop looking at Facebook and all the negative things that everyone's sending you, and just delete everything for a long time. And now I have definitely like come back to everything. And I think that it's a good reminder, like what both of you are saying right now, is like nobody's like connecting like with your family when we're all like on these screens all day long, and we already have like homeschool and just everything with computers all the time. So just really, really happy to hear that people are finding ways to still live life and be growing their food, and just, starting communities in these other ways that we're going to be like going into. I can envision it, but still, like rushing to like post the flyers to let people know about things like this, it's like a balance. We have to always find our balance with everything and center and ground, and just really thankful for us to bring all this up today. It's good.
That's really great. I've learned that I delegated the social media task to my stepdaughter. She loves, kids love social media. So I'm like, hey, how about you manage the social media account? So I can focus on other things that I like to do. And so I've learned as a business owner to delegate the tasks that you don't like to do, to focus on, the tasks that you do enjoy doing, so it doesn't disrupt your creative flow, because that's super important. And when you're providing services out, right, and you're constantly giving out, you have to put that back in. And so I practice meditation every single day. It's a daily thing for me. It's something that I do every day. I do the oils every day. I have the crystals every day. I wish I could journal every day, but I do mindfully journal, but being a parent is a lot of work when you want to be the best parent you can be. It's not easy. Now I don't agree with it, but now I understand what makes, you know, unhealthy parenting happen the way it happens, because it's a lot of energy. Kids are a lot of energy, beautiful energy, right? But a lot of things, and I think it's important to prioritize that when you want to, raise beautiful children in this world to contribute positively. You have to keep your priorities in order, and if being off social media is one of them, then that's what it is.
Yeah, absolutely. That's how I feel sometimes. I'm just like, I'm just trying to do one homework, Like, this is like one day that might be like so bad. I'm just like, okay, let's turn it off and let's start walking or something. I have to like shift something because it's like this task that I'm trying to do is impossible. And maybe someday I'll, I'll do it. But there's just that one day that it feels like, wow, it just seems it's not gonna happen. So yeah, it is, and we're never taught how to be parents. Um, and you definitely need to up your skills. Like I'm definitely like always like we have to up our skills and we have to continue improving with ourselves because otherwise, we can't say, well, this is who I am. I don't know. For me, I don't believe in that phrase. Like this is who I am. Deal with it. I'm just like, well, good for you, but I can't live that mantra. I have to be like, why do I have these triggers and how can I release them and how can I be better and that's really important for me. So like even in my this week we started doing a curriculum of 3 books. One is the Anatomy of Peace. Then from there we're gonna go to crucial conversations, and then outward mindset. And we're just gonna do that with the family because there's times I don't have the answers, and my husband might come to me like, this person did this and blah 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 blah. What should we do? And sometimes I feel drained, and I'm like, I don't know, like you figure it out. Sometimes I feel like that. And so it just feels like we all have to be in the same vibration. Like, say I'm increasing my mind, but then they're not. It just doesn't work. So it's
Mm-hmm.
like we're all gonna like start trying to shift something. Not that it's a perfect path, but this should help to shift something, and we're all going into the same direction.
Mhm. I like to use the analogy of like for every, let me see, can you see my finger here? Okay. For every one finger you point out, you have three more at you. So for every time you point out externally, bring it back to you and be like, okay, bring it back to me. What is making me feel triggered instead of why, right? Because why can be very judgmental. So what is making me feel triggered? Because essentially we want to live a life where we're not triggered, right? And pre pandemic, I used to tell clients the world could be falling apart and you're fine. You really are fine. And now this happened, and it's like, whoa. Some of them are like, hey, I remember you used to say that the world could be falling apart. Is this what you meant? And I'm like, exactly what I meant, because the pandemic for me, although I've seen a lot of negative things and unfortunate things, for me, I've chosen to thrive in it, right? To whatever is happening, to find positives in it and enjoy what I have and make the best of what I have. And so I'm very fortunate that I do the work. I practice what I teach people because I believe in it. And so I think it's really important to do the work yourself as a clinician, as a healthcare provider. If you teach meditation, meditate. If you're a yoga teacher, do the practice. If you're a massage therapist, believe in it. I know clinicians that are counselors that don't believe in counseling at all. They would never go see a counselor. I don't believe in that. I think that if you need the help, you need the help. And, even as parents, there's times where I'm like, oh man, I could have totally handled that way better than when I handled it. And what do? I go research, like, how can I handle this in a more effective and nurturing way and, healthy way? Because I want to grow as a parent and, learn from the cycles that I want to break and want to continue, right? From my own upbringing. And so I think it's important to be accountable. It's totally fine if you made a mistake. It's totally fine if maybe, you didn't express your true essence for a moment. I think it's totally fine to feel crappy, but one of the things that it becomes unhealthy is when you're not feeling well and everyone else feels that detriment. So be the best person and best version that you can be, so that you're your best version of you for you and everyone around you.
Yes, absolutely. I believe in that 100%. And you could just do is your best and moving forward versus staying stuck and beating yourself up because you did something. Like, I had to learn that one too. Do
I was
not
gonna
beat
say,
myself up.
breakdowns are also healing. That's what I'm learning. I'm like, I get that overwhelmed middle week breakdown sometimes, and I'm just like, everybody watch me break down. Okay, now everybody steps it up and does more though. And I'm like, okay, that worked. But how can
Yeah.
we not get to that point, right? That's what we're trying to work on.
Human beings have emotions. And so some individuals are afraid of emotions, right? As a society, we don't encourage, hey, you should cry, right? What do you tell kids? No, shh, stop crying, shh, right? It's a shush kind of society we've grown up with, especially with, the older generations. They were not allowed to cry. They were not allowed to have emotions. And so now, the newer generations are like, feel everything, right? Talk about your feelings. And so I think as parents, we do the best that we can. And, there is such a thing as mom guilt. It exists, it's super real. I think that it's super important to honor your self care. It's not being selfish. It's honoring you because you deserve it, and take care of yourself and nurture yourself for the, goddess that you are, because being a parent is such a blessing.
Yes, definitely. I always tell my parents, especially postpartum, it's like you need to take care of yourself so you could be good, centered for your baby. Uh, if something happens to me, I mean, I have a lot of kids. That's gonna be like very chaotic. So I really believe in taking care of myself. If I have to sometimes like choose like clothing or something that's gonna help me, like a massage, I'll be like, a massage, please. Because I really enjoy that. It's like I feel like I could do this again, and so yeah. But yeah, thank you very much for this talk. I feel it's really important to, at least allow people to understand, what is health awareness, what their rights are when they were trying to move from different, counselors or clinicals or clinicians. There you go, and understand where they have options, no matter what situation they are, and to listen to their intuition. I really feel that that's really important as well, because we are trained as as we're growing, not to listen to our intuition, and we could go on from like birth controls, and you don't know what's going on with your body or your birth, and so we could go on and on how that is linked to that, and so that could also link into mental health. And this is why sometimes we submit and just continue going even though we want to say no. So we could probably have another talk on that too. But I think that's really important. And so yeah, next episode that we're going to be talking about will be a birth story that I feel is going to be exciting on home births. But yes.
All right. Well,
Yeah.
thank you so much, Brenda. It was really, really nice to have met you in the past, and then also see you again virtually, and know that you're not usually virtual, and know that you exist and that you're bringing all this amazing services to community. Thank you
Thank
for the
you,
work.
ladies. Thank you for everything you're all doing too for the community. That's so amazing that you're, being so connected to inform, right, people and educate them, because it's super important. So thank you so much, and many, many positive vibrations to this journey for you all.
Yes.
And all the listeners too.
Yes, absolutely. All right then. Bye.
Bye, everyone. Thanks for listening.